Construction Organization, Accident Prevention and Management. Group 20 with Adam Sin, Dwayne Spate, Jack Sontag, and David Smock. I am your presenter. I'm Dr. David E. Smock. I'm an occupational physician with practices in Arizona, California, and Missouri. I'm what's considered the company's doctor. My job is to decrease the reportable work comp cases, to ensure that employees have a safe work environment, as well as help companies deal with regulations regarding medicinal and non-medicinal uses of drugs, as well as ADA compliance. They call them accidents because they weren't planned. Every employer is required by OSHA to provide personal protective equipment to their employees. They're required to ensure that their equipment is guarded, and that part of all of their work procedures include some type of safety planning, prevention, and education programs. Yet despite faithful employers, as well as OSHA's inspection, there are still many work injuries that occur every single day. Since many of you will be employers, employer managers, or work in some aspect of being in charge of other people, what are you to do? The answer is plan for the accident, with the key, of course, being prevention. Then, when the accidents do happen, be actively involved to control the work comp case. Step by planned out step. Implementation of a post-offer, pre-placement, job qualification, history, and physical exam. According to the American Disabilities Act, you cannot disqualify someone simply because they have a handicap. However, you can ensure that they are qualified to do the job based on the physical requirements. This practice is carried out by the military, by the police, by the firefighters, and by most healthcare workers. Determining if a possible employee has pre-existing limitations or prior work injuries is essential to preventing a future work injury. In construction, not many jobs can be modified in such a way that a disabled or prior injured person can meet the job requirements. Step 2. A drug-free workplace. As part of many employers' hiring practices, they have a drug testing policy. When designing a drug testing policy, it is recommended to follow federal guidelines of the DOT, the Department of Transportation. This alleviates the problem dealing with the current regulations which allow the use of recreational as well as medicinal marijuana, opiate abuse and use, as well as illicit drugs such as methamphetamines, cocaine, or heroin. Drug and alcohol testing is not only a good practice at hiring, but during the entire course of an employment. The government allows you to test employees who behave strangely under the category reasonable suspicion. Step 3. Implementation of OSHA compliance programs. Implementation of programs which protect the lungs, the bloodstream, hearing, or the eyesight can prevent future injuries, as well as allow for job rotations when noted deficiencies are starting to occur. Step 4. Finding a clinic who is familiar with OSHA First Aid versus OSHA Medical. Many cases can be handled as it would if it was a school nurse, where you simply put a Band-Aid on, reassure the person, or provide some mild palliative care. As a company doctor, I often recommend for my companies to avoid chiropractors because they don't believe that anyone will ever recover. Subluxation, which is the displacement of the spine, occurs naturally according to their belief system and needs alignment and realignment on a regular ongoing basis. This is a source, according to chiropractors, of recurrent back pain, joint pain, knee pain, and other bodily dysfunctions. I also recommend for employers not to allow their employees to seek care with private providers. The main reason for this is their private provider who gives them their general health care is more sympathetic and will give them unlimited time off. Step 5. Implementation of a return to work program, also called light duty jobs. Orthopedic surgeons have found that individuals with back injuries actually will worsen by staying at home and in bed. Returning to work provides not only distraction but encouragement, and has been found to reduce the time that it takes for the injured worker to recover. Step 6. Accident investigation for job reengineering, job rotation, process improvement. Job reengineering. If the injury occurred because of the way that the work site was set up, often the work site can be re-engineered to decrease the likeliness that the injury will reoccur. Job rotation. If the job requires repetitive action, it sometimes is best to limit the amount of time doing a specific job, thereby limiting the amount of exposure to injury. Process improvement. Look at the job where the individual got injured. Determine if there is an easier or better way to do the job, which would then reduce the injuries. Light duty work. Your insurance carrier would be willing to help you creating a return to work program, thereby reducing their expense and reducing your future expense. Step 7. Case closure. It is important to decrease the cost and decrease the time off from the injured worker. This will lead to a lower experience modification rate. It is allowed by law for an employer to send a representative to attend doctor's appointments, to understand the treatment plan, to coordinate with specialists or specialist studies. Don't let the case stagnate. The longer a case stays open, the more expensive it will be for your company in future premiums as well as actual out-of-pocket cost. Step 8. To settle a case or fight. If an employee has a permanent injury and if the company is at fault, it is better to settle. If you're not at fault, it is better to fight. The industrial court, however, is just as uncontrollable as regular courts. Industrial court. This is where the injured worker takes his case against his employer to determine if the employer was at fault, if his work injury case will be paid for by the employer, or for the employer to win a non-fault decision. Step 9. Final review. Now that the employee has returned to work, review how the injury happened. What steps can be implemented to improve the outcome? How was the medical treatment managed? What preventions can be implemented and improved upon? This final meeting should include employees, employers, safety managers, and possibly engineers. In summary, planning and preventing of an accident is an essential part of the construction organization. In the references, you will find the websites which will help you to further understand the cost of work injuries, preventive measures, as well as legal ramifications of the work injury.